So we've just finished week 4. It was pretty much, I've said before, it was recapping stuff that we'd done in previous modules, so linking the upper and the lower limb together, and then also working at how that affects the rib cage. We have touched on stuff before with Shane and how the lower limb affects the rib cage, or the rib cage affects the injuries of the lower limb. I've kind of just got a little bit more of an understanding as to treatment of the rib cage, and also how important the obliques are in playing that role with the rib cage depression. Yeah, I think I've kind of understood more the importance of the rib cage, and also understanding that you don't just go straight to an injury, you kind of assess the whole body as a whole, which is what basically the whole of the mentorship is trying to get you to understand. Another good thing as well that I've started to learn is the technique of the assessments themselves. So the upper and the lower limb were really good in allowing you to do that, and this has just been another thing that I could have added into the assessment, which has been really good as well. So last week I did mention that in the clinic we were offering the half-price massages, which meant that we got pretty much fully booked, like within the first, obviously, the week. So over the 2 weeks I was completely busy, didn't really have much time for mentorship stuff. With week 4 I did manage to get through that in the first week as well, so I was managed to keep up on to date with that as well, which was really good. The videos are quite short, there's not that many videos in there as well. I think there's only about 11 or 12, and then you've got your quiz as well. So yeah, it was really easy, and especially knowing as well if the videos are only like 3, 4, 5 minutes long, it kind of encourages you to be like, oh actually I've only got 10 minutes, I might as well just get the next video done whilst you sat here, and it does kind of, it definitely helps. So I'm just moving on to week 5 now. I'm kind of expecting it to be a little bit like it was for the lumbar spine, so I think that you've kind of got to have the understanding of the upper and the lower limb, and then kind of add the cervical spine into that. We've not really, since uni, I've not really, in fact, I'm going to be completely honest, since uni I've not touched anything cervical spine wise, because I think a lot of a lot of therapists get a little bit paranoid that they're going to do some damage or something, so I tend not to do anything from the neck above. I don't touch. So it will be quite interesting actually to see what some of the hands-on techniques are going to look like, and obviously how to do an assessment for that as well. From what I've seen as well, there's a lot of videos, so I'm a little bit apprehensive of how I'm going to fit that in again, because we've still got a lot of massages running as well in the clinic. But yeah, it should be absolutely fine. I'm not too worried. I'm quite excited to get started.
Okay, so for the neck, what's really important, it's really similar to like our lumbar assessment where we're looking at toe touch, etc. But obviously we're just going to bias it specifically to the neck. Now there's a lot of tissues around the neck that can kind of get a bit overwhelming and a bit confusing sometimes, but just keep it really, really simple. So the things we want to look at is axis of rotation, so whereabouts in the movement do they get in the pain, and what tissues are involved in terms of shortening and lengthening at that stage, and then etc. Being able to look at how those movements apply to those certain tissues, that can really help us zone in on what we need to treat in the first session to desensitize the symptoms. So our first one obviously is really simple, it's just chin to chest. So if you bring your chin to your chest, Sarah. Good, and back up again. Nice, just do it a couple of times. Good, and how does that feel?
Fine.
Good, nice. Just do it facing that way for a second, just so I can look at it from the side. Nice, good. And Sarah's pretty good there. So again, what I'm looking for with the neck flexion is, first of all, do they get good chin tuck? So do they get a good upper cervical flexion? And then can they bring the chin all the way down to the chest? What you'll see a lot is people open the mouth to do that, you know, because they don't want to go all the way down. If you say chin to chest, they'll just open the mouth to get the chin to the chest. Again, I want to say keep the lips together, see if you can do it in that position. And then I want to see when they're getting the pain. So if I'm getting pain as soon as I start to move, I'm probably thinking more upper cervical, whereas if it's just as I get to the bottom, I'm probably thinking more lower cervical. Again, extension, if you just look up towards the ceiling, nice. So it's going to be important for this, obviously, if you face that way for a second, just for the camera, Sarah. To start with, we want the upper cervical to extend. So if you look up towards the ceiling, we need that upper cervical to extend here. So that's going to be a lot of like SCM proximal attachments. So obviously the SCM posteriorly is going to be shortening if we look at it. But if you look at the attachments here, this part of it actually needs to lengthen. So that's a really, really important one for flexion. And then obviously as we get to the end of the movement, we've got the lower cervical as well, which again is going to be the proximal attachments of the SCM. And if you just face the far wall here, Sarah, for a second, the other big one that's really important, obviously we've got side flexion, which again is going to be SCM massively as well, upper trap, but rotation's a big one. So if you look over towards me, cool. Now what you'll see a lot, and I'm sure you've seen this area in clinic, is you get a lot of patients when they're looking this way, they might get pain on the same side. So they actually feel the pain on the closing side. So for Sarah's looking left, she's feeling it on the left side. So the tissues that I think are really important for that is if you look at the attachments in at the spine, at the upper trap and the serratus posterior superior, as you look over your left shoulder, all of these spinous processes higher up here are going to actually go over towards the right. So that portion needs to lengthen. So that can be a bit counterintuitive. It looks like it's shortening, but if we look at where the attachments are in here, anything that attaches from here onto somewhere here, because these spinous processes are going to be going that way, that's actually lengthening. So they're really important to consider for anyone that has that same sided ipsilateral sided pain, and then obviously the same when you're looking over your right shoulder. So it's really simple, really. It's just breaking down the assessment. What point of the movement is the pain coming on? What tissues are involved with that? Make sense?
So it's just flexion, extension,
and rotation. Yeah, you can check. I think you got your side flexion as well. So again, side flexion, we're going to have our upper trap. We're going to have the opposite side SCM that's going to have to lengthen quite a bit, and we're going to have like the splenius cervicis, splenius capitis need to lengthen in the frontal plane. To be honest, I'm more interested in flexion, extension, and rotation because I think functionally they're the things that have more of an impact on people. So like if I'm driving, I'm going to look over my shoulder in the car. They're the kind of things that bring on the pain for people, whereas we don't normally do these movements very often. I still think they're important to check, but I think functionally the ones that are really going to resonate with people and really expose the issues that they have generally is when they're looking over the shoulder in the car, or like they're bending over to read a book or pick something up from the floor or something like that. And then obviously you can zone in a little bit on your upper cervical, like we talked about earlier in the week. That could be, so if you do suspect an upper cervical issue, obviously there's a lot of other things then we can check for the upper cervical as well.
Yeah. So what kind of like restrictions kind of thing are you looking for? Do you know, with the movements, like we said with the toe touch, we're wanting them to obviously bend the back. What kind of things we're looking for with the spine? Just good range of movement.
Yeah, good range of motion. Again, the big things that I want to see is there's no cheats, so like they're not keeping the mouth open to try and make the distance shorter. Exactly, and upper rib cage is important as well. So if I'm going through my chin towards my chest, I need to be able to do that. So I need my upper rib cage to be able to depress. Does that make sense? Same as I'm looking up, I need to be able to lengthen through my upper rib cage as well. So looking lower down, we can look at a lot of other things that are going to be important as well. But specifically for the neck, it's just really range of motion and whereabouts in the movement do they get in the pain.
Yeah,
does that make sense?
Yeah.
Big clearing things you might want to check for somebody is like jaw stuff. So like if you've had any teeth removed or braces, stuff like that, that can be important, as well as then your upper limb stuff.
Okay.
Make sense?
Yeah.